In 1957, a man was admitted to a hospital in California. His name was Mr. Wright, and he was dying. Lymphosarcoma, tumors the size of oranges in his neck, his armpits, his groin. Doctors gave him less than 2 weeks. Remember this man, because what happens next medicine still can't explain. Not fully. Not even now. In the last 3 videos, I told you about branches of reality, about the door, about the state that holds the wheel, and maybe you were thinking, nice theory. But it's just words. Honestly, you'd be right to think that theory with no proof is just a comfortable story. So today, no theory. Today, only what's documented, records, published research, cases with names and dates, things that already happened and are still waiting for an explanation. Back to Mr. Wright. He's dying. 2 weeks less. And then he hears his hospital is testing a new drug, reservation. The newspapers are calling it a miracle. Wright begs his doctor, Dr. Philip West, to let him into the trial. By the rules, he can't. Too sick to qualify. But the doctor makes an exception, 1 injection, on a Friday. By Monday, Dr. West walks into the room and can't believe what he's seeing. Wright's tumors, as he later wrote, had melted like snowballs on a hot stove over 1 weekend. Half their size. 10 days later, Wright is discharged. He walks out of the hospital and goes back to flying his own plane. A man who had 2 weeks left. But that's not the end of the story. That's only half of it. Months later, headlines start running. Reservation doesn't work. Trials have failed. Wright reads them. His tumors come back, all of them, in the same places. And this is where Dr. does something that would never be allowed today. He tells Wright, "Don't believe the papers. We have a new batch of the drug, purified, twice as strong." And he injects him with plain water, distilled water. Zero medicine. The tumors disappear again. Wright lives 2 more months healthy, flying, breathing, living. The final report comes out from the American Medical Association. Reservation is worthless. Period. Official. And within days, he's back in the hospital. 2 days later, he's dead. Same man. Same disease. What was killing him and reviving him? Wasn't the drug. There was no drug. What was driving it was what he believed. Dr. West wrote this case up in a medical journal. It's published. It's still cited today. It's not a one-off oddity. Medicine has an entire file of cases like this. It's called spontaneous remission, documented cases where a disease that should kill you just leaves. No treatment, no explanation. There are more than 1,000 of these. In the medical literature, Institute of Noetic Sciences built a catalog of them. 500 references from 800 journals in 20 languages. Oncologists know about this. They just don't like talking about it. Because on the question of why, medicine doesn't have an answer. A different experiment, Houston, Texas. A surgeon named Bruce Moseley is doing knee surgery, arthroscopy, a standard procedure for arthritis. Hundreds of thousands of these a year. And Moseley decides to test the thing nobody wants to test. He takes 180 patients. Some get the real surgery, a fake one, real anesthesia, 3 real incisions in the skin. But inside the knee, the surgeon does nothing, just goes through the motions. He even splashes water around, so it sounds right. The patient wakes up with stitches and has no idea if the surgery happened. 2 years of follow-up. The result that surgeons are still arguing about. The fake surgery worked just as well as the real one, reduction. Same recovery in mobility. People with the fake surgery were walking, stairs, playing with their grandkids. The knee fixed, something that was never touched. This is published in the top medical journal on earth, the New England Journal of Medicine. You can look it up. And here's the question sticking out of this. Like a nail, if expectation can dissolve a tumor, bring it back, and then kill a man, if expectation can fix a knee with no surgery at all, then what is expectation? Calls it the placebo effect. A nice, clean name, but listen to what it actually means. It means the body did this on its own. We don't know how. The name exists. The explanation doesn't. And here's where you should remember video 3. I told you your state decides which road you're able to see, backs that up, and stops at the threshold. But Mr. Wright's case is already past that threshold. His state wasn't just choosing what he noticed. Inside him was flipping his body between living and dying. Back and forth. He was crossing between two branches. In one, a man who recovers. In the other, a man who dies. The bridge between them, every single time, wasn't chemistry. It was certainty. I won't tell you. He was switching realities. Nobody knows that. One day science finds the mechanism, and it turns out to be boring. Maybe it never finds it. But here's what's already true. Right now, somewhere in your body, there's a system capable of doing something medicine can't reproduce on command. It doesn't switch on with a pill. It switches on with what you believe without reservation. Remember the man on the corner? I told you fear was choosing every step he took. Mr. Wright is the same mechanism running at full power in both directions. Belief got him out of bed, or article killed him. Same wheel. The only question is who's turning it. And now, something important you need to hear clearly. This does not mean illness can be cured by mood. If you're sick, see a doctor. Get treated. Wright, without that hospital, wouldn't have lasted a week. Placebo worked inside medicine, not instead of it, and it does not mean that someone who didn't recover didn't believe hard enough. Spontaneous remission is rare. Nobody knows why it comes for some people and not others. Anyone who tells you they know is selling you a lie. But here's what it does mean. There's a mechanism inside you with a kind of power you've never seen on a chart. Stop pain. Fix things that can't be fixed. Sometimes dissolve the thing that was supposed to kill you. Says it plainly, the mechanism is real. We haven't found the switch. Now think about what that mechanism is working with every single day, with whatever you believe about your own life. I'm not going to make it. I never get lucky. That just doesn't happen for me. If a dying man's certainty could dissolve tumors, what is your daily certainty about the worst doing to your life right now? Drop one thing in the comments. One thing you believe about yourself that you've believed for so long. You don't even remember deciding to believe it. Just look at it written out in your own words. Sometimes that's enough to notice whose voice you mistook for your own. Subscribe. The next crossing is already close.